morning, and thank you for staying with us on Citizen Daybreak. We really appreciate that you woke up with us and you are with us until now. As we shift gears into health and lifestyle, it is Wednesday, and we are glad that you are with us on this very pivotal month that we are marking awareness around the deaf community. It is the Deaf Awareness Month every September, something that began as an international week to observe, what the deaf community are all about. That was way back in 1958. I don't know whether you were born, but it has since morphed into an entire month of just advocacy and helping us understand what it means to really live with this particular challenge of not being able to hear. But then again, we always take advantage of this time also to talk about matters hearing loss, because for some it starts there. That's when it ends up to complete, you cannot be able to hear. And we'll talk about how that hearing loss relates to deafness, how they the difference between the two, and of course also just generally how you can take care of your ear generally. And I'm glad this morning to be joined in studio. Of course, we were expecting Dr. Richard Mwangi, but of course we have with us in his place Dr. Eva Mwangi, who is also a consultant audiologist at Doctors of Hearing Kenya, and she's going to be helping us delve deeper into this awareness month and of course what is happening when it comes to just developments and interventions around helping people to be able to hear better, right?
Yes.
Thank you so much for creating time for us this morning, Dr.
And thank you for having me.
All right. So let's get straight away into it. And first of all, let's begin by it's a month that is very crucial, especially for you and your colleagues as stakeholders in this particular area. You've done a lot, seen this journey transition from one point to the next. Probably you can tell us a bit more about how this month has been and why is it significant, and probably what stands out for you with regards to what, as a country, we've been able to be part of, activities that we've been able to be part of this particular month.
Good. So Deaf Awareness Month is celebrated globally, and it is primarily there to raise awareness on the challenges that the people who are deaf or hard of hearing face. But it's also a time when we celebrate the deaf culture. It's also a time when we create those policies and remind people and the society as large how to really bring in the inclusivity of people who are living with us with hearing loss as a disability and even born deaf or acquired deafness. Mm-hmm. Yes.
All right. I was drawn into the theme for this year of the Deaf Awareness Month, which really focuses on, setting the basis for the future. Together we can innovate, inspire, and impact. Yes. It's sort of futuristic, and also it's a call to action for innovation, yes, to in this particular area. But I'd like to hear more from you, yes, looking at the coining of this particular theme and what probably you can translate it to mean for you as a stakeholder and also as a doctor in this area.
Yes, working with hearing loss, maybe I could just bring it to the basics, mm-hmm, on what hearing loss is. Mm-hmm. We look at hearing loss as the loss of ability to perceive sounds. Mm-hmm. But what we don't really talk mostly about is where really is the effect of this hearing loss happening. Mm-hmm. We do know that the ear is the organ that carries the two main functions, function of hearing, function of balance. But it really is just the organ that transports the sound. Because what we normally say nowadays is that we hear with our brain. Mm-hmm. The brain is the actual organ that constantly is stimulated by sound. Mm-hmm. Once the sound hits the ear and it's translated from an acoustic to our electrical thing, and it goes through that nerve pathway to the brain, we tend to see the brain now getting fed by sound. Mm-hmm. What happens now in the process of hearing is that we start gaining all these good things in the auditory process, on the sides of the brain, but we also see other areas of the brain getting fed. The area of memory, mm-hmm, critical thinking, executive memory, and also the vision. We tend to see all of this playing a part in promoting hearing of an individual. So when somebody loses that gift or that ability to hear, we tend to see direct effects happening in the brain. So in return, what do we see? We see that other areas start getting affected. People start having issues with their memory. When we tend to see clients in our clinic, they don't just complain about hearing loss. They will start saying that, I keep forgetting things. They will start noticing that over time, they're having to rely on their vision to actually hear. And this is because the sense of hearing has gotten affected, not just at the ear level, but at the brain level.
It's interesting that you've said that, because I think that's a deeper way of looking at this hearing function of a human being. We sort of really never looked at it that way, connecting it to the brain and considering the fact that the brain is sort of what really makes the entire human system do what it is supposed to do. So losing that ability to hear, the damage that it can cause to the entire system of a human being, it's good that you've really opened our minds to that depth. Let's talk about, how we get there. How do you tell that you're beginning to lose your sense of hearing? What are some of the things you can look out for to be able to know that now we are getting into the red line when it comes to my ability to hear well?
One thing I'll say is that hearing is a very silent health crisis. It cripples in very slowly, and you find by the time somebody notices that I have to turn up the volume of the TV louder, I have to ask people to repeat themselves, I have to make my phone volume louder. By the time it gets there, and those are some of the things that we mention as the earliest signs of hearing loss. Not to forget having ringing in the ears. All that is also a sign of early sign of hearing loss. But the thing is, by the time we get there, it's already been there for some years. You'll find that by the time somebody's noticing that I have to tell my colleague or my family member to speak louder, they're already at a 40-50% hearing loss.
That's a dangerous thing if you ask me.
It is. It is.
Because 50%, that means this thing started way back.
Way back. It's actually said that people take an average of 5 to 10 years to get to a hearing doctor, meaning that they noticed signs slowly by slowly. Other people never really noticed. Maybe the only thing they felt is a ringing in their ear that wouldn't go away. So by the time they are getting checked, it's actually the people around them that they've told them, "Ay, wewe huskiangi." They've actually been told, I have to repeat myself constantly, or when we're in a meeting, you're not actually following through. And by the time it's that level, which we say are the earliest signs, it's already a 40-50%, which is usually a moderate hearing problem. So what are we saying? Hearing loss comes in slowly, gradually, most of the time. In other cases, it could be a sudden hearing loss, but that is special cases which, when caught early, it can be reversed. But when we are talking about a sensory neural hearing loss, it mostly it builds up slowly.
Having said that, looking at the society today and this being an awareness month, what's the level of what's the magnitude of undiagnosed, actually, let's begin there, undiagnosed hearing loss that we could be having out there? We have numbers, but I don't think, considering what you've said, the numbers quite give us the real picture.
I could say it's a huge number. Because one thing you'll notice is, as human beings, we would go get our blood checked. We would go probably for a dental checkup every year, but hardly ever do we see people going for a hearing check, which should be done annually, right from birth, right? So you would find that a lot of people will miss out on this and only go to see an ENT doctor or an audiologist like us once the problem is already there. So the numbers are there. I don't have the data to share with you today, but I could tell you that majority of the people would come up and show up once it's already at that bad level.
It's true, because Kenyans, we have the habit of waiting until we cannot bear it anymore, until the pain is too much. That's when we seek medical attention. So you can imagine how many people are walking out there and they have a hearing problem without really knowing that it's something that needs to get checked by the doctor. Let's talk about the things we do every day, the care, the hygiene. What are the things that are dangerous? Let's begin with the bad before we get to the good. Okay. Things you see people do, or things you hear people do that actually lead or escalate hearing loss without really having the information.
Yes. So one thing that we see a lot is people using the cotton buds. The cleaning of the ears has become such a norm for people to use things, probably go and itch with something. And I'll do a lot of education. And what I normally tell my patients or people that I educate is that the smallest thing that should enter your ear is your elbow. Anything smaller than the elbow can be damaging to the ear. And why do we say this? Because
the elbow, can it? No,
it cannot.
So it's, in short, you're saying nothing.
Exactly. Nothing should go in. Why? Because the ear is a self-cleaning organ. The ear naturally will move wax outwards. And so what we tend to see when we're taking a bath is that there'll be accumulated wax right at the entrance. And that is ideally what we should wipe out. That's the only form of cleaning we should do. Whatever is in there, it's good wax. It's there for a reason, for own protection. And so we should actually not do anything to it. So that's one bad thing that we tend to see. The other thing, of course, is just, if we talk about children, I talk about even some adults, we'll tend to see people going in with pens, and all those things. Those are bad habits. Matchsticks. I've also heard about people using some form of oils, homemade oils, just to put in their ears when they feel itchy. Those are not things that I recommend. So, and our ears have been made in a very special way where we really don't have to do anything other than having an annual checkup.
You've heard that? Do not clean your ear. It will do, nature will take its own course.
Nature will.
It will clean itself.
Yes.
All right, let's talk about devices and, how that is also, how do we handle that? Because you've talked about the sound, the volume, and in this era where a majority of people spend like a very large percentage of their day with earphones, whatever kind of device they are using. Talk to us about where we are going with that and what we should watch out for.
So over the years, we've had causes of hearing loss being mentioned as ear infections, as age-related, but we've actually seen a shift happening over the last, I could say, 7-10 years, where noise-induced hearing loss, or rather noise exposure, is becoming one of the leading causes of hearing loss. What you'll get to know is that noise is one of those things that we can 100% prevent. But then it's also one of the leading causes. We're talking about billions of people, both youth and, adults, elderly people getting noise exposure. And this now comes in from those devices that we are talking about. We're looking at introducing loud sounds into our ears. And when I say loud, I mean anything that is over 85 decibel. To put it into perspective, if we took out a sound level meter right here, we would be probably talking at about 60 decibels.
60.
So 85 is not so far off. You will notice that a lot of people will use direct headphones or earphones at 90, at 95. We talk about the loud matatus, which go over 100 decibels. We talk about the loud...
And they've written there, if it is too loud, you are too old.
Thank you. So what does this do? This sound directly goes and damages the organ of hearing. The actual inner ear. Those hair cells start to die off. And this now causes a permanent hearing loss. So when we say that noise exposure is the 100% kind of hearing problem that you can actually avoid, it is true. Because if we listen on safe levels, if you can still use your headphones, but use it below the 85 decibel mark. And nowadays, technology has actually, you can see through your phones that you're going into a higher level. So If we avoid them, and if we cannot avoid them, then we use them at safe levels. So promoting safe listening levels is really what we advocate for when we talk about the gadgets. Now, coming into hearing loss and devices, that's also another thing that we've seen improving a lot. We used to have the big and the beige. I like to call them that way, where hearing aids were they were being called, big and beige because of just how they looked. Yeah. They were very analog. Yes. They were visible. The only thing they would do is pick the sound, amplify it, and put it into the person's ear. So in return, a lot of people hated hearing aids. Yeah, anytime you would mention a hearing aid 15 years ago or 10 years ago, a patient would be like, nope, I'm not ready for that. And why is that? Because sound would be very distorted, sound would be extremely loud, everything would be amplified. But what we have seen over the last couple of years is that the introduction of technology and innovation in hearing aids has shifted that. You remember me talking about the brain and hearing loss. The hearing aid manufacturers used that data to now change how a hearing aid works. So other than just amplifying sound, they brought in sound processors and artificial intelligence that cleans out the sound for this patient and actually mimics how the brain works. So in return, somebody who now wears a hearing aid enjoys very good quality sound, just like a normal hearing individual. So now we see a lot of these devices are being accepted even with younger people. They are no longer big and beige. They are small, discreet, they're invisible. They work according to the patient's hearing level, and they are very customized to the need of the patient.
So they've been AI enabled, for lack of a better term, to really function closely to what the brain does.
Exactly.
And they've also become more good looking, more sophisticated. You'd actually not know these days. I don't know the last time I saw somebody with a hearing aid visibly, and I could identify that this is one. I couldn't, but I want to believe they're out there and they have these gadgets. Maybe technology has advanced and how they are made is a bit different. But before we get to the point where a doctor like yourself recommends a hearing aid as the intervention, what happens in between?
Good. So first thing for us to do is to make sure that we can tell what is your level of hearing. So coming in for a consultation, coming in for hearing assessment, which takes some time, but you find by the end of that visit, we are able to know exactly where the problem is. The ear being divided into 3 parts, we assess all the 3 areas. So we get to know, is the problem in the outer, the middle, or is it focused on the inner ear? So once we get to that diagnosis, and how is the actual level? Speech tests are done, audiometric tests are done. All this would help us determine where the problem is and what is the severity of this problem. So once we do that, now we tailor-make the solution depending on what the issue is. Right? And that's where now we talk about different ways of managing. It could be a medical way where maybe it requires surgical intervention or medical intervention, or it could require a rehabilitative way, which is where now the hearing devices come in. Yes.
All right. And one question probably that one would want to know at this point is, what is the difference between hearing loss and deafness, because it's the Deaf Awareness Month, so that we know the extremes and how one correlates with the other.
Yes. So when we conduct a hearing assessment test, we want to identify at what level is your hearing capacity. It ranges in different levels. We could either find that there's a normal, a mild hearing, a moderate, a severe, or a profound. So when we say somebody has a hearing loss, or they are hard of hearing, they either in the category of mild, moderate, moderately severe, or severe. When we now find that there's totally no sound perception up to all the levels that have been tested, then that's when we can say there's total hearing loss, or what we call deafness. So not everyone is deaf. I personally avoid using that term. Why? Because we need to really state it as it is. You know, somebody could just be having a hearing level that is low, and so they're not deaf. They're really just hard of hearing. Yes, so this month...
Do you experience those cases, or have you heard of scenarios where somebody is being categorized as deaf and they're not deaf?
Yes,
yeah,
a lot of them. I'll say most of the cases we see in that category are the children, especially those who either got a hearing loss born through it, so congenital, or maybe they acquired it very early in life. So what happens in most cases, they will delay in speaking, or they will not speak at all. Usually we like to say that there has to be an input for there to be an output. So if a child, let's say, was born with a very severe loss, they did not go through the audiometric testing, they did not go through the pediatric testing, and so it was never really identified that they have a hearing loss at this level. So you find that either they were just left to stay at home, and they were immediately taken to a school of the deaf. So this child would start growing up knowing that they are deaf, knowing that they are probably, this is what it is for me, and maybe that's what the parents have known. And then later on, you find that they come for testing at some point, and we find that they actually have some hearing level, residual hearing, probably moderately severe or severe, and they could have actually benefited from a hearing aid right from the word go. So we definitely see some of these cases whereby they went on, being termed as deaf, but they actually had some residual hearing.
Speaks to the level of the lack of awareness and the lack of knowledge around, the inability to be able to hear, or those who are not able to hear well.
Yes.
And also, there's a lot of stigma and shaming that comes with this particular challenge. As doctors of hearing, probably you could run us through what sort of things you've been able to do to be able to address the unique challenges that the deaf community are facing, and also those who are having hearing, challenges are also facing. What is it that you're doing to make life more livable, more enjoyable, more things more accessible for them?
Good. Yeah. So as doctors of hearing, we're really proud because for the last 3 years, we identified a group of deaf cyclists who, they had a talent, they had a course, but we identified them, we gave them the support that they needed through their cycling gears, we sponsored them through major cycling events, and actually right now they've been selected by the government of Kenya to represent us in the Tokyo Deaf Olympics this year. So that's one really...
That's a good step.
That's a highlight that we're really proud as doctors of hearing, getting to see cyclists who are now achieving their dreams and, breaking the barriers and saying that, deafness is not inability, or, hard of hearing is not inability. So that's one thing. The other thing we've done a lot is in community outreach. We've done a lot of outreach in different counties. Like recently, this year, we were in Murang'a County, just spreading awareness, providing hearing screening services, providing diagnostic and, hearing aids for those who needed. And we did find that a lot of them had that lack of awareness about their challenges. And then the other thing we tend to do is we support our team. Internally, we have sign language interpreters within our team. We encourage our team to learn sign language because we know that this is something that we will come across on our everyday as we go about working with people who are hard of hearing. And so this really speaks about the inclusivity that I was talking about, where even in our workspaces, we as doctors of hearing and even other hearing doctors, we want to, encourage people to be able to learn sign language, because and appreciate it as a national language. In Kenya, we have the Kenya Sign Language.
It's the third, recognized as a third national language.
Yes, so just recognizing that, being able to use captioning in our communication, being able to promote out and be able to highlight, like in the recent years, we had a movie for the hard of hearing that we sponsored, and it was also a highlight for us in supporting this deaf community and making them know that, we see them, we hear them, and we are part of them. Yes.
It's good that you say a lot is happening. I think we have a TV station for the deaf community as well. There's a lot that is happening around technology and just making sure there are apps that can be able to offer this sign language interpretation. And I know we have a long way to go, but let me run you through something I came across interestingly, and the need to really cascade this information down to the rural areas. Because I was looking at the 2019 Kenya population and housing census numbers of the numbers of deaf people we have in our country. They stood at over 150,000 people aged 5 years and over in Kenya are deaf. Majority of them, that's about 130,000, live in the rural areas, living about 20,000 of them living in the urban areas. And I want to believe it is in the urban areas that people like you are concentrated, audiologists are concentrated. It is in the urban areas that this language of devices, AI, technology is concentrated. What do we do to this majority that are silent in their small corner of the world, in the rural areas, in the villages? How do we break the barriers for them?
Now, thank you for bringing that up. The thing is, breaking the barrier will definitely need to involve going to the grassroots level. And this means that more community outreach is needed. Like I mentioned, Doctors of Hearing has managed to go through some of the counties, Murang'a, Nyeri, Nyandarua, Kajiado County, but then it's not enough. A lot more needs to be done. So I think this is where now we have to call upon everyone else, hearing experts, to just get to the grassroots level and be able to talk. One thing I'm happy about is that the government is creating these spaces in the level 5 hospitals. So we are now seeing a lot more people getting trained and going back to those counties and just offering some of this ENT and audiology services. So at least it's a step that we are seeing from the government, but definitely a lot of advocacy, a lot of awareness needs to be done. My take, I think even in the schools, we need to start there. Because this is where we'll see the children who probably have a problem with one or two of their ears and they have not been checked. They don't know where to go. They don't know that it's an actual problem. So if we're looking at starting from those down levels, we should also consider going into not just the community, but also in schools, to reach even the very young people.
It's good to tap into the deaf community and also those who are having hearing problems. But then again, what is being done in the area of empowering those who can hear? With regards to how they need to relate with these people. Because for example, let me just use a very basic example. A young child who has hearing issues, before they get to realize that this child actually has a problem that needs help, they've been told all manner of things. Nikichwa ngumu, aski maneno, they're ignoring people. There are parents who would actually even decide to take their children back to the rural areas to stay there because handling them and helping them to navigate around life becomes quite a challenge. What is being done in the area of just creating awareness to help the caregivers, let me call them that, be able to find it easier and manageable to work with people who have this challenge?
So one thing that I know has been there for a number of years, and this started in the UK, is something we call newborn hearing screening. This is a program that allows parents who have newborns to seek or get a hearing screening check done right from the time the child is born.
This is like sort of recommended for every child?
It is recommended for every child. I would say that not all hospitals are doing it, but now in Kenya we see a number of hospitals doing it, whereby even if they're not done before they exit the maternity, at least they're told within the first 3 months, get a hearing check done for your child. I don't know if everyone is doing it yet. I don't believe it is, but it is something that we really, really talk about because early intervention is really key. if we are able to identify it as soon as birth. Because our hearing system starts working 3 months before we are born. So it is possible.
Even a two-day-old child.
Yes, even a 1-day-old child can recognize their mother's voice because they've been hearing it for the last, in the womb. And so once that hearing organ is, working well, we're able to screen it. We're able to run some tests when the child is just asleep. And we're able to tell whether this child has a normal hearing or not. And if there is anything that is of doubt at that point, we can do the next test again at 6 months, at 1 year, and every year. So for me, I believe early intervention in terms of just promoting that neonatal screening, promoting annual hearing checks, those are things we can actively do. And that's something that anyone can do. We don't have to wait until we're a certain age to get a hearing check done.
All right.
Yeah.
Talk to us about eliminating stigma and the shaming in this community. Let's get to understand, what they go through and what needs to be done to be able to just get rid of that aspect of the challenges they go through.
Yeah. So stigma is still with us.
Yeah.
It's a big thing. But I won't talk about stigma without mentioning the effects of hearing loss socially.
All right.
So we do see that people who have hearing loss, they tend to socially withdraw themselves. And that social withdrawal, isolation, often leads to depression. So you'll see actually 70% of people who have hearing loss have some level of depression. Why am I saying this? It's because we tend to see people who develop a hearing loss. They will not say. They will actually be quiet about it. They will just start withdrawing themselves. Eventually, they don't want to be around people. And even when people get to know about it, they will start shaming them. It will be like, where uskiangi? We tend to hear some of those things.
Uskiangi maneno.
Yeah.
So it's very hard to communicate with that person. So people just avoid.
Exactly.
Yeah.
So one way I think we can do is really talk about it, educate on those effects of hearing loss. And I think that can get people to get help, to seek help sooner than later. And one thing I want to say also is that it's not always the individual who has a hearing loss will get to know that they do. It's usually the people around this person that will actually start to notice that so-and-so is actually putting the TV too loud. That so-and-so is actually missing out on conversations. So it's rather than speaking at them, we actually need to speak to them and bring them closer and encourage them to get a hearing test done. So if we now, change the narrative on how we are talking to these people, and, instead of shaming them, we are actually encouraging them that, nowadays we have very good solutions regarding our hearing. So you can actually get checked, advising them where they should go to get checked. I think those are some of the ways we can do that. And of course, talking about it, raising awareness. That is the number one way we can see at least the problem of stigma going away. In terms of solutions, I think those have already been put there. We have amazing solutions available in terms of hearing devices that's already breaking the barrier in regards to stigma. So the biggest challenge is getting this patient to the doctor's office. Yeah.
One thing I'm wondering actually is also in terms of access to these devices and to this technology that you are saying is now there, and it's really sort of like changing the narrative for people who have the hearing challenge. Probably, how do we make sure that even that person who is in some village in far-off county has access to this? The language you're talking about is AI. We're talking about devices, assisted hearing aids. But there's somebody who probably has been locked out of all this due to maybe, cost or even knowledge on how to use them and all that. What is it that is being done to make sure that nobody is left behind in this narrative that we are talking about today?
Yeah, so one thing is that hearing doctors or audiologists, we do not work in isolation. We work with other practices. We work with other doctors. And so I believe one thing that has been done is getting even the very doctor at the health center. Let's start there. Get to know, if we get this person to know that when somebody presents like this, they most probably have a hearing loss and they should be referred. So creating a very good referral system within our hospitals and our communities, I believe that's one way that we can achieve getting this patient to the right doctor faster. Because what happens is that a lot of people will be told, oh, it's wax. Or maybe you have wax.
Wash your maskio.
Wash your maskio, come back.
Yeah.
So that really, what it happens is that it prolongs the treatment, It prolongs even the intervention. But if we actually get to have even the, health center, the district hospital, if they're still there, county hospitals, if they get to be told that, this is the right way of having the referral system in terms of hearing health, I believe that we'll have a better chance of our people, our community, getting the help. Now, in terms of accessibility and of hearing aids are now available. We are at a place where, as a country, we have the hearing devices with us. Walking into a hearing facility and getting the hearing tested, that's the number one thing.
Yeah, it starts there.
It starts there.
Yeah.
And once that is done, the solution is offered. And hearing aids have a wide range. You find that according to the need, somebody is given what is suitable for them. Yeah. For me, I say the cost of losing my brain health cannot be measured, in terms of money. Because if I look at the effects of hearing loss, and we are talking about the brain cognition getting lost, we are talking about a 16% chance of getting dementia. Because of a hearing loss, I would rather treat that hearing loss, than stay at home and wait.
All right. So how do you also get to know that this person, you've tried all sorts of interventions and nothing else can be done for this person? So now then, the only way they can be able to manage this is probably now be categorized under the deaf community.
Yes.
And also talk to those who probably are experiencing hearing loss and they are wondering, is there hope? Like, what can be done? Where do I start?
Yes. So for those who have been diagnosed with profound hearing, or what we call deafness, again, hearing aids are not the only solution. We also talk about cochlear implants. If it is identified and early enough, when the child is still within an age that surgical intervention can be done, then we see cochlear implants coming in very well. But in cases where this was missed out on, then we now start rehabilitating or habilitating this patient into the deaf community, where we talk about now learning sign language, learning total communication. That's actually what we advocate for. And what I mean with total communication is using both sign language and verbal communication. So we are not just signing with this patient or with this person, but we are also using, verbal communication to face them and look at them and actually talk to them using total communication. We also see now a lot of integrated schools coming in. So for those children who have this kind of a problem, we encourage them, the parents, to have their children join integrated schools where they can interact with both normal hearing children, and they can still get assisted in the same school with special teachers, right? And then, of course, in the workspaces, we're looking at, having that inclusivity of using of the sign language and the total communication. Now, for those who have hearing loss, where it's not deafness, getting that intervention done early is still the key. And the first step is to start by getting a hearing test done. It's quick. It's within, let's say, 45 minutes, you get to have your whole consultation and your tests done, and you start talking about solutions. Yeah. What we tend to see is that when a hearing aid is introduced, we tend to see immediate change. One, the clarity of the sound is achieved immediately with a good device. And slowly, within 30, 60 days, we tend to see also the brain stimulation starting to happen. And so we tend to reverse those effects that we talked about earlier with the use of a good hearing aid.
A good hearing
Yes.
aid. But I also caught you say something, that it's not just in all cases you get the hearing aid. In some
Yes.
cases you can get...
Cochlear implant.
Yeah, and,
Yes.
and that actually does it for you. But
Yes.
you've mentioned quite a number of spaces that are opening up for people who have this challenge,
Yes.
education.
Yes.
I'm looking at the health sector,
Yes.
employment.
Yes.
But with the current setup, would you say we are there, in terms of even how many audiologists do we have? Leave alone even the audiologists,
Yeah.
even just the other doctors who
Yes.
can understand the basic sign language to help patients who've gone there to seek medical services get the help that they need. How many do we have? If you look at employers, how many are willing to go the extra mile and the extra cost to accommodate an employee who has, the hearing challenge?
Yeah.
Just look at the current context and tell us what you see and where we should be.
I think we are not where we were.
Yeah.
But we
Or at
have
least
a long...
you started from an optimistic point.
Yes, we're definitely not doing badly,
Yeah.
but we still have a long way to go.
Yeah.
I think if we can have more conversations around this, then a lot more people would be aware, because it starts there. I think also in terms of numbers, we have also grown in terms of audiology. We are not the only ones who come across, there's a lot more people that comes in play when we talk about intervention. We have speech therapists. Yeah, we have sign language interpreters. All these are people that work with the deaf community. And good thing is that, it's not just narrowed down to audiologists, because audiologists, we will diagnose, we will manage, but this patient still has a whole life ahead. Yeah. And so they need other people. We have the special teachers, we have the, all these people that, make up this community. And so I think we have come a long way. We have gone at the days where we used to say we're only 10 in the country. At least now we have numbers, we have people. And good thing is that doctors of hearing, we have the licensed also, we have the Kenya government licensed audiologists. So we are able to give that guidance when it comes to the way forward. I think with the place where we are at right now, somebody would not get lost in space. Very few people, because information is there. And we have different categories of experts who come in play when it comes to dealing with this person who is hard of hearing.
All right.
Yeah.
I want you to talk to me about some of the success stories, milestones you've seen people achieve.
Yeah.
Things that, because one person, I read somewhere that there was a quote about the deaf people can do everything. The only thing they can't do is hear, but they can do everything. So with proper interventions, they can actually be able to communicate and achieve like a full,
yes,
circle of life.
Yes.
What is it that has inspired you doing what you do? Stories of revolution, stories of transformation that you have interacted with, examples of key figures and personalities that maybe you can throw in just to encourage a person who is watching you this morning and they are facing the challenge and they are wondering, will I ever really, have quality life and live my life to the fullest?
Yes.
As an expert, what can you share with us that can inspire?
I think one key story that is close to my heart is a child that I met when they were just 4 years old. And we diagnosed a profound hearing loss. And I remember at that time, the parent was very key on immediate intervention. And so we got them a good hearing aid. And right now we're talking about somebody who is finishing their USIU university, somebody who was able to go through their primary level, their secondary level, and they're now graduating, in the USIU. For me, those are key success stories that I say, surely, if we get this early enough, we're able to give somebody their full life, I could mention a lot more stories. If I just look at also our deaf cyclists, they all have unique individual stories. And these are people who are working in the workspace. You know, some of them are even dental technicians. You know, they are doing life just like any one of us, despite them having a hearing loss or deafness. And so, yes, for sure, this is something that we should, you know, talk about and say that, you know, we can break these barriers, and it's definitely achievable to live a normal life. Because what you'll tend to see is that these people, as much as they don't speak, they communicate. Yeah, either they communicate with sign language, but they communicate. They lip read. Not all of them got this deafness at birth.
Yeah.
Some of them were hearing very well until something happened and they could no longer hear. So they had their speech. So they had acquired their speech early in life, but they later on lost the level of hearing. And so you find there are different people you tend to see. And it has to start from also the individual, you know, getting to that level where they accept. Because it has to get to the acceptance level. Once we accept, and then we start intervention, and, you know, we create our own success story. I think it's achievable. I think it's possible.
All right.
Yes.
And, you know, as we finalize, because the month will be coming to an end in a few days, what would be your clarion call? Talk to the government, the policymakers, talk to parents, caregivers, talk to the deaf community themselves, and even people who are experiencing hearing loss. What is it that you'd like as a way forward, you know, on this, so that when we are here next time, same time, we will be talking about the progress that we have, the steps we have taken, not negating the gains.
Yes.
What is it that you'd wish is done between now and then?
Good. So I think one thing from the family level, community level, is just getting to know how to address people who are deaf or hard of hearing. You know, simple things, face them, don't talk at them, talk with them, you know, use total communication. But then again, as we go into the workspaces and into the schools, I would wish to see more integrated schools. I would wish to see more people in the workspaces, including, you know, people who are hard of hearing, because these people are so talented.
Yeah.
You will see them work and you'll be so amazed at the kind of work that they can do. And if we look at now the government level, I would wish to see policies in place that would actually bring in the aspect of, you know, hard of hearing and deaf people included everywhere. You know, so that's really where I wish that we could see, you know, more good policies that would allow us to live together with these people and not exclude them, be better understanding on how to live with them. You know, I'm glad that we are now at a place where, you know, captioning is something that is a standard, you know, in the conversations and in, you know, in communications out there, socially and all that. We also, you know, want to get to a place where we want to see these people accepting to wear a hearing aid, knowing that especially if you have any form of level of hearing, it can be amplified, then it should be amplified with a hearing aid. Yeah. All
right. In terms of cost also, I want you to speak to that, because having any form of disability gives you that extra burden of cost for you to be able to really acquire the quality of life that you desire.
Yes.
In the context of hearing, what do you think needs to be done to be able to assist those who are experiencing that challenge as well?
Yes. Now, in terms of cost, that's where now...
Like a basic hearing aid,
yes,
an example would go for how much, and how many Kenyans can be able to afford that?
Now, that becomes a challenge to say, because remember me talking about the customization. Yeah, you find that once we diagnose this issue, that's at the point, at the level where we can now talk about the cost. Yeah, you'd find that it becomes very difficult for us to just pick a call and say hearing aid will cost this much.
This is the price.
It's really not possible.
Patient.
Yeah, because I call it a prescription. It's a prescription. Yeah, it will depend on the issue. Some people have a high frequency problem. Others would have a low frequency issue. You'd find that even when we do that test, the need is different. So it becomes a different situation when we're talking about that. But again, we are now at a place where, you know, we want to see more being done also by the government institutions when it comes to health matters. And, you know, we want to see more happening with the insurance companies and covering these devices and, you know, including them as medical devices, actually, and not luxury, because it really isn't. You know, so those are the things for me I would want to say that I would want to see more being done so that even people who have medical insurance can be able to acquire these devices. Yes.
Yeah, thank you so much, Eva, Dr. Eva Mwangi. She's a consultant audiologist at Doctors of Hearing. Asante sana for creating time to discuss this with us. Of course, it's just the beginning. Let's not end this conversation with this awareness month. Let us sustain this conversation all throughout the year in our families, in our small spaces there, to be able to accommodate and to make life easier and better for those who are deaf and also those who are experiencing hearing loss. This year's focus actually is driving us to meaningful change, to have inspiring conversations around accessibility, to help us also be able to have a community where the deaf voices are heard. They are valued, they are celebrated, and they are made to feel like they are actually present in this world. That's what we should all gear towards. Thank you so much for watching Health and Lifestyle this Wednesday. We do this again next week. We appreciate your time and company. My name is Safin Acheng Oma.